motion for debate on Thursday. Scheduling the debate for Thursday will, I hope, give members an opportunity to consider the motion and a response to it. The motion will appear on Thursday's order paper to be taken after any urgent questions or statements. Hopefully, there won't be any. I hope this is helpful to the House. Yeah. Right, order. We now come to questions to the Secretary of State for Health and Social Care. I start with Sir Charles Walker.
Mr. Speaker, question number 1.
Secretary of State.
Thank you, Mr. Speaker. I know that my honourable friend has long been a passionate advocate for smoke-free England, and I read his recent Westminster Hall debate with interest. 64,000 deaths a year are attributable to smoking, and it is one of the greatest drivers of health disparities in our country. And I'm personally determined that we do everything we can to reach the government's ambition of smoke-free 2030. And that's why in January I asked Javed Khan to lead an independent review into tobacco control. Once that review is complete, the government will set out its next steps.
Sir Charles.
Secretary of State for his answer. To get to a smoke-free 2030, for every 100 people smoking today, we need to reduce that figure by 8, because smoke-free actually means 5% or less of the adult population smoking. Can I ask the Secretary of State to ruthlessly target those barriers that stop people stubbing out their last cigarette? We need to get the numbers of smokers down, because otherwise 2030 will be an ambition that is not achieved.
Mr. Speaker, my honourable friend is absolutely right. Smoking rates are currently 13.5%. That's the lowest on record. However, smoking remains the largest driver of health disparities in our country. The new tobacco control plan, which will be informed by this new independent review, will be looking to do exactly what my honourable friend says.
Mr. Speaker, as one of the original campaigners for a ban on smoking in public places, I fully support what has just been suggested. But could I go further with the Secretary of State and beg him to come to House very soon with a plan that every child, every person, every family in this country can breathe clean, fresh air, away from the pollution coming from diesel vehicles and other sources?
Mr. Speaker, the honourable gentleman has long been a campaigner on this issue, and I commend him for that, and he's right to continue pushing. I don't want to preempt the outcome of the independent review, because it is just that. It is a fully independent review of government. But once that is complete, and I plan to publish it in May, hopefully, then I think that we can set out our plans.
Ben Bradley.
Number 2, Mr. Speaker.
Secretary of State.
With your permission, Mr. Speaker, I would like to take questions 2 and 19 together. The past few years have shown that we are our strongest when we work together. Earlier this year, we published the Integration White Paper, drawing on our experiences of the pandemic to develop a plan that will bring together the NHS and local government to jointly deliver for local communities. We have also created integrated care partnerships, such as programmes in Mid-Nottinghamshire and Northamptonshire, and we are already showing through that how we can bring health and local social care services together.
Ben Bradley.
That answer. I understand as COVID regulations come to an end, the discharge fund is also set to end. This could leave local government vulnerable, where there are no formal procedures locally to pass funding from the NHS into local government services, into local authorities, particularly as we seek to reduce hospital backlogs. We're vitally important that we get people out of hospital and into the appropriate care settings. So can my right honourable friend assure me that where local authorities are seeking to do that, seeking to tackle those backlogs, they'll have access to appropriate funding to be able to do it as we go forward?
I can give my honourable friend that assurance. Of course, we are already putting in record amounts of funding, both for local authorities to deal with the backlog that my honourable friend talks of, and into the NHS. But I do believe that with the plans that we set out earlier this month in the new plan for integration of NHS and local authority services for care, they will make a real difference.
Thank you, Mr. Speaker, and I thank the Secretary of State for his references to the work going on in Northamptonshire over health and social care integration. Can he assure me that that central role for local government in ensuring health and social care services work together to make the most efficient use of local resources will continue, and give me a clear guarantee that adult social care will not be taken over by the NHS?
Secretary State.
I'm pleased to give my honourable friend that assurance that he seeks. The integration white paper, that signals our intention to go further and faster on health and care integration, building on the work that's already being done by the NHS, by adult social care and by local government, jointly to deliver services. That plan will lead to better collaboration, and we want to make sure that responsibility, though overall, still lies as it is currently shared between local authorities and the NHS.
Valerie Vars.
Thank you, Mr. Speaker. The Secretary of State will know that Walsall Manor has been merged with Royal Wolverhampton. They share the same chief executive and chairman, without consultation with local people. How on earth can integration take place when Walsall Manor doesn't have a full-time chief executive who can ensure that this happens? Could the Secretary of State please ensure that Walsall Manor gets their own chief executive?
Secretary State.
Mr. Speaker, I do understand the point the Honourable Lady is making, but it is about what works on the ground. And my understanding is that what's happening locally in her area is about a shared management team where they're sharing best practice and trying to look at challenges together rather than any kind of formal merger.
All right. Alex Norris.
Thank you, Mr. Speaker. Across the country, tens of thousands of people sit in hospital, medically fit to go home, but can't due to a lack of social care.
Yeah.
And the Health and Care Bill should have addressed this, but didn't do.
Yeah.
So, rather than just making us wait for more legislation, will the Secretary of State at least concede that local health leaders, be they in CCGs or in ICSs in shadow form, should be driving this locally as a matter of urgency?
Mr. Speaker, this is exactly what the new integrated care systems, the ICSs, are all about. My understanding is the Honourable Gentleman sat on the Bill Committee for the bill that's currently in front of Parliament to make that a reality.
Come to the Shadow Secretary of State, Jake Murray. Went straight to.
Thank you, Mr. Speaker, and he clearly had a happy Easter. Look, Mr. Speaker, the fact is that the government's failure to fix the social care crisis is causing huge pressures on the NHS. As of last week, more than 20,000 patients were in hospital, fit to leave, but could not be discharged because the care isn't available. That means 22,000 patients waiting more than 12 hours in A&E each month. That means heart attack and stroke victims have to wait over an hour for an ambulance. So we're used to hearing about a winter crisis. Isn't it the case that after more than a decade of underinvestment in the NHS, a failure to fix social care, and the absence of a plan to even address the staffing challenge in the NHS or in social care, we don't just have a winter crisis, we have a permanent crisis in the NHS?
It's not the case at all, Mr. Speaker. And the Honourable Gentleman will know, and he does know this, Mr. Speaker, although he pretends not to, that the NHS and social care are facing unprecedented pressure because of the pandemic. He will know, as a result of the pandemic, that both in NHS settings and in adult social care, there has been a necessity for infection protection controls. He will know that staff absences are sadly higher than they have been in normal times, but the NHS is stepping forward with their colleagues in adult social care to provide whatever support that they can bring, especially with the record funding that the government is providing both to the NHS and adult social care.
Jake Murray.
Mr. Speaker, working with my honourable friend, the member for Hyndburn, we have been working with East Lancashire local authorities and our GP services to see if we can increase the number of face-to-face GP appointments. Will my right honourable friend, the Secretary of State, say what action he and the government are taking to ensure people in East Lancashire can see their general practitioner face-to-face?
My honourable friend, Mr. Speaker, is absolutely right to raise this issue. We've heard it time and time again in this chamber that the pressures our constituents are facing in order to get that kind of face-to-face access to their GPs. We all know why the situation was particularly bad at the height of the pandemic. We expect it to improve rapidly. The percentage being seen face-to-face is increasing substantially, and that's in large part because of the measures the government has taken, including the £250 million Access Fund that was announced a few months ago.
SNP spokesperson Martin Day.
Thank you, Mr. Speaker. Integration and service improvement cannot be delivered without sufficient staff, and the only way to attract people to a career in social care is by valuing them. In Scotland, they are already paid better than those in England and Wales. And through the National Care Service, the Scottish Government will improve terms and conditions for care workers through the introduction of national paid bargaining. Has the UK Government considered following the Scottish Government's approach and commitments?
Same state.
Integration between the NHS and social care requires the right level and quality of workforce, both in the NHS and in adult social care. In the NHS in England, we have more doctors and nurses, more people working than ever before. In adult social care, we are recruiting at high levels, not least because of the huge recruitment campaign that we ran together with the sector, and also some of the other changes we made, including the £400 million plus of retention funding over the winter period, and the support for workforce more generally is making a real difference.
Peter Bell.
Mr. Speaker, in Northamptonshire, integration is getting on very well, and in fact, Councillor Helen Harrison heads the adult social services. But going back to what my honourable friend from Northampton South said, there is the worry that because the NHS is so big that it will overwhelm local government. No, they don't. I told you, Secretary of State, they don't want to mess with Helen Harrison, but could you assure that there's a mechanism for reviewing that?
So, State.
Well, Mr. Speaker, I know that my honourable friend knows Helen Harrison extremely well, but he's right to talk about the importance of working together between the NHS and the adult social care sector and local authorities, but at the same time making sure it's a true partnership and one does not overwhelm the other, but they work together towards their shared interests.
Alan Morgan.
Thank you, Mr. Speaker. One of the key causes of the urgent care crisis in Shropshire in Shrewsbury and Telford Hospital Trust is the inability to discharge patients who are medically fit to go home into social care in the community. And Shropshire Council's resource challenges are well known, I think, in that area. I wonder if the Secretary of State can commit to putting extra resource into that area, into social care in Shropshire, so that the medically fit can be discharged into the community when they're ready.
So, State.
Mr. Speaker, the honourable lady is absolutely right to raise this issue, and the whole House heard just before the recess the results of the work done, the independent work by Donna Ockenden, and she's right to talk about that and the pressure that's been faced locally. I do understand that she's already reached out to my honourable friend, the Health Minister, and he will be meeting with her to discuss just that.
Question number 3, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. The dental activity threshold has recently been raised to 95% of usual activity, which is another quarter-on-quarter increase to get us towards pre-pandemic levels of 100% of activity. But I fully recognise that before the pandemic, access to NHS dentistry was patchy, and the crux of this problem is the current NHS dental contract. So work is underway to reform this contract. Negotiations have started, so I'm limited in what I can further say on this, but I will update the House as soon as possible.
Thank you very much, Mr. Speaker. A number of my constituents are finding it impossible to get access to NHS dental care, including Alison, one of my constituents who worked as a midwife in NHS Hospital for 40 years. Some of them have contacted 40 different practices and haven't got anywhere. My understanding is there's been a 30% drop in the dentists taking on NHS work in Suffolk. Will the Minister explain to me what local work has been going on between the Department and the local NHS bodies to try and ensure that this is addressed?
Minister.
I thank my honourable friend for this question. He is quite right, and he's campaigning very hard to increase dental activity in his constituency. One of the key pieces of work is through Health Education England, who set out a range of recommendations in their Advancing Dental Care Review, which will do a number of things, such as increasing the skill mix and scope of practitioners across dental teams, and we may require legislation to bring some of that work forward. They're introducing more flexible routes into dental training, and they're also doing some workforce modelling to identify the parts of the country with the biggest gaps, so we can establish centres of dental development in those areas. And I will look at Ipswich in particular.
Emma Harding.
Thank you, Mr. Speaker. My constituent contacted me to tell me that she'd broken her canine. When she went to contact her NHS dentist, she found she'd been kicked off the list was looking at facing a bill of £4,000 to pay privately, which she simply doesn't have. I wonder what the Minister can do to speak to some of the dental practices about perhaps relaxing their rules around when people get kicked off their dental lists, especially since it's just been COVID and there might be legitimate reasons for patients missing appointments.
I'm sorry to hear about the Honourable Lady's constituents' experience. There isn't actually a list system for dentists as there are for GPs. Patients can see any dentist when they have a dental issue. That said, we have asked dental practices to update their availability for NHS patients on the website. I was looking at the website this morning to see availability across the country, and many dentists still haven't updated their availability. So I'll ask officials, particularly in her constituency, to update those lists so patients can access NHS dentistry more easily.
Sir Peter Bottomley.
Can I join the Minister in thanking dentists and their associates for getting so much of the service back? Will she agree with me that in places like the Arran parts of my constituency, where people can't find a dentist, haven't been able to for 2 or 3 years, that there must be a way they can get on a dentist list and get treated, and that they should be properly rewarded? Dentists and patients will be grateful for a change in the contract.
Minister.
Many thanks, Mr. Speaker. Can I thank the Father of the House? He is quite right that the crux of the problem is that there isn't a shortage of dentists across the country. There's a shortage of dentists taking on NHS work, and the contract is the nub of the problem. And that's why we have started work underway to reform the contract. And there will be some short-term changes being announced shortly, and some longer-term reforms as well, which hopefully will help his constituents.
Jim Shannon.
Mr. Speaker, bearing in mind that dentists are now determined to turn their practices wholly private as they can't make ends meet with NHS prices, will the Minister pledge to review NHS payments to stop this hemorrhaging of NHS dentistry provision?
Minister.
I thank the honourable gentleman for his point of view. He is correct that the units of dental activity payments are a perverse disincentive. So sometimes when someone needs more extensive work, their dentist is paid the same as say, for 1 or 2 simple fillings. And that is the nub of the problem, and that is something that we're in negotiations about at the moment.
My honourable friend, the Minister, is absolutely right to talk about the contracts that we have with dentists, but should she not also be looking at the way in which dentistry is structured and the regional nature of the contracting, because it's outside of our clinical commissioning groups, which reduces coordination, reduces accountability, and something which is central to our health. Shouldn't this change?
Minister.
I thank the right honourable lady. She is right, and part of Health Education England's review of the overall system of where dentists are trained and where they fill the gaps is being addressed in their Advancing Dental Care review. And they're also working with commissioners at a local level to develop more opportunities in those places which we term dental deserts, where there is a lack of provision at the moment.
Shadow Minister for Roseland.
Thank you, Mr. Speaker. Mr. Speaker, NHS dentistry is in crisis. Patients are stuck with a never-ending wait for an NHS appointment or footing the bill for going private, which is simply not an option for most families suffering with rising bills and taxes. With a third of the population suffering from untreated tooth decay, when is this government, who have had 12 years, finally going to come up with some practical solutions that put the needs of patients first, rather than the half-baked and unworkable ideas we have heard to date?
Minister.
Well, I'm sorry to hear the tone from the honourable lady. It is actually the 2006 Labour dental contract that we're working under. She may have missed that for the last 2 years, during the pandemic, dentists weren't able to offer any routine care, and we've slowly had to work that up to 95% of usual activity. And she may want to play politics with this issue. Perhaps she wants to talk to her Labour colleagues who run the NHS in Wales, where 6% of dental posts were lost last year. So before she lectures this side of the House, maybe she needs to get her own side in order.
Steve Bryan.
Thank you, Mr. Speaker. With the exception of the last question, I don't think that anybody on both sides of the House who've raised this issue are playing politics with it. There is clearly a pattern emerging here of a backlog in NHS dentistry and access to it problem. I have an increasing number of constituents contacting me who've gone to their NHS dentist with an acute dental problem to be told they're no longer seeing NHS patients, and people who've fallen off the list, as the lady from Hull mentioned. So how can ministers help in the short term? And I know the long-term answer is around the contract. I used to give that answer too when I was in her seat. Will the minister meet with me over a cup of tea so that we can try and, as a start of a 10, get to the bottom of this, please?
Minister.
Well, I thank my honourable friend for his question. We've had many cross-party meetings with colleagues on the issue of dentistry, and many have raised constituency issues with me, and we have followed those up. The two things that I would suggest to him is firstly to speak to his local commissioners, because there is sometimes a problem with local commissioning of dental services, but I'm hoping he'll find now we're moving to 95% of usual activity, which is a significant change since last year, that his constituents will be able to access services more easily.
Steve McKay.
Number 4, sir.
Minister.
Thank you, Mr. Speaker. Earwax services are the responsibility of local commissioners, who are responsible for meeting their local healthcare needs. And depending on the arrangement of the local area, services should either be undertaken at local primary care practices or referred to appropriate local NHS services.
Steve McKay.
Well, obviously I want to thank the Minister for that answer, but I was recently contacted by a constituent who complained that he was told by her GP surgery that such services were no longer available on the NHS and she should consider obtaining them privately. This despite recent studies which link the effect of impacted cerumen on cognitive decline and dementia. In those circumstances, will she consider writing to clinical commissioning groups and reminding them of their obligations and patient entitlements?
Minister.
I thank the honourable gentleman for his answer. There is no national removal of earwax removal services. They can be commissioned still locally, and NICE guidance are very clear on the types of services that should be being commissioned. Traditional methods of manual ear syringing are no longer offered for safety reasons, but methods such as electronic irrigation or microsuction should be being offered. If his local commissioning group are not commissioning those services, I'm very happy to meet with him and them to discuss why not.
Thank you very much, Mr. Speaker. For decades, GPs did provide this service, and we all understand, because of NICE guidance, why they no longer offer syringing. But I have to say to my honourable friend, there is a gap in that many clinical commissioning groups are not doing this. We're talking about people with dementia. We're talking about people at end-of-life care who literally cannot hear and are going deaf. And I do think she needs to be very direct with clinical commissioning groups on this issue.
Minister.
I thank the honourable gentleman for his raising this point. He's absolutely right. There needs to be some consistency across the country in how these are being commissioned. And after questions today, I am taking this up with officials to see why this isn't happening consistently across the country.
Number 5, Mr. Speaker.
So stay.
Mr. Speaker, I'm determined to tackle unfair disparities in health outcomes, which is why I launched the Office for Health Improvement and Disparities. OHID's regional directors of public health will work with local government and the wider health system to empower local partners with the tools that they need to respond to disparities in their regional and local areas. And we will also be publishing a health disparities white paper later this year with a strong focus on prevention to improve health for the whole population.
Secretary of State for his answer, but the reality is a decade of underinvestment and mismanagement has meant 4.5 million people are on waiting lists and over 100,000 people shortages of staff before we even entered the pandemic. That exacerbated health inequalities. And while I welcome his announcement about the work that his department's doing, the reality is if you live in a constituency like mine, you're twice as likely to end up on waiting lists for over a year for treatment than those in better off areas. So while I welcome what he's announced today, can I ask that he puts in appropriate investment to go along with tackling these appalling health inequalities?
So stay.
Mr. Speaker, I think the Honourable Lady is absolutely right to talk about the importance of tackling health inequalities, and I think on that we absolutely agree, and I hope she will help contribute to the Health Disparities White Paper I mentioned a moment ago. But I do think it's wrong of her to suggest that some of the current challenges we face is because of underinvestment or a smaller workforce than otherwise. We have the largest investment ever going into the NHS. Its budget this year is bigger than the GDP of Greece. It's the highest amount ever, rising by billions each year. We have more going to social care as well than ever before, and we have the highest level of workforce the NHS has ever seen in its history.
Thank you very much, Mr. Speaker. Surely one of the most cruel health inequalities lies in fertility treatment. Of the 106 CCGs in the country, only six limit the age at which women can have IVF treatment to 35, and 2 of those are in Hampshire. Would the Secretary of State meet with me to discuss how we can end this most devastating of postcode lotteries?
My honourable friend is absolutely right. Of course, I'll be very happy to meet with her and discuss this further. But I can also tell her that this is one of the key things that we will be covering in our new upcoming women's health strategy.
Shadow Minister Andrew Gwynn.
Warm words from the Secretary of State, but people in the most deprived parts of England are almost 3 times as likely to lose their lives from an avoidable cause than those in the least deprived areas. With the cost of living soaring and the Resolution Foundation estimating that 1.3 million people will be pushed into poverty as a result of the Chancellor's spring statement, these inequalities will worsen. Why won't he just admit that his government has failed the poorest communities and start doing something about it?
Well, Mr. Speaker, the honourable gentleman acts like health inequalities are something that just emerged under this government. They've been long-running health inequalities in this country over decades under successive governments, and it's this government that is putting in record investment and coming with the ideas to deal with them. As ever, Mr. Speaker, the Labour Party, they have no ideas how to deal with the challenges that this country faces.
Jonathan Gillis.
Thank you, Mr. Speaker. Mental health is a serious challenge of our time, and it's totally unacceptable that waiting times, the average number of sessions and the minimum number of sessions is different depending on which part of the country that you live in. And sadly, in Stoke-on-Trent, we've seen recent statistics showing that people taking their own lives are double the national averages. And that's why I'm proud to support a cross-party campaign, the No Time to Wait campaign led by James Starkey, with the backing of the Telegraph and the Royal College of Nursing, to create a provision of mental health nurses in GP surgeries, which can make a real difference to those who bravely come forward asking for help. Would my right honourable friend meet with me, members in this House are supportive, and James, to discuss how we can make this possible?
Yes, of course, Mr. Speaker. I'd be delighted to meet with my honourable friend and with others to discuss this campaign. And I know my honourable friend speaks with passion. It's something that he's long campaigned on, and I have had time to look at some of the content of this campaign, but I would certainly be happy to discuss it further.
Dr. Alan Whitehead.
Thank you. Number 6, Mr. Speaker.
Minister.
Thank you very much, Mr. Speaker. Reducing waiting lists and waiting times, exacerbated, of course, by the impact of the pandemic, is a key priority for this government. Southampton, like the rest of the country, will benefit from the detailed actions set out in the elective recovery plan published by my right honourable friend, the Secretary of State, a few months ago. And in addition, as part of Solent Acute Alliance's hospital upgrade programme, the University Hospital Southampton NHS Foundation Trust has received £12.1 million to increase capacity at Southampton General.
Dr. Alan Whitehead.
In speaking with the Hospital Trust in Southampton, which is an excellent provider, they are desperate to get back to elective surgery and non-life-threatening procedures, but find they cannot, because they cannot integrate COVID treatment into general ward activities, and they have a continuing high level of staff sickness, which means that procedures are often undertaken very inefficiently in terms of resources. What assistance can the Minister provide for Southampton University Hospital Trust to enable them to get on the front foot as far as elective procedures and non-life-threatening treatments are concerned in the near future?
Minister.
Well, I'm grateful to the honourable gentleman. He quite rightly pays tribute to the staff at his hospital trust, and I join with him in doing that. We've seen the number of those waiting in his area for an elective procedural routine operation reduce slightly. There's more to do, but they are making inroads, as he says. I know they want to do more. As we set out in the elective recovery plan, some innovations, such as, for example, surgical hubs, which allow a greater separation between COVID areas or areas where COVID may be present and elective activity, is a key part of that. But if it's helped him, I'm always very happy to meet him to discuss the specifics of his local hospital.
Ian Lavery. Question number 7, sir. Minister.
Thank you, Mr. Speaker. The Government is committed to tackling poor quality housing. In the Social Housing White Paper, we committed to a review of the Decent Home Standard to test whether it is up to date and reflects current needs and expectations. The Levelling Up White Paper sets out a commitment to halve levels of non-decency in all rented homes by 2030, with the biggest improvements in the poorest performing areas. These reforms will have a positive impact on health, and we work closely with the Department of Levelling Up Communities and Housing to support their implementation.
Ian Lavery. Thanks, Mr. Speaker. The NHS spends a staggering £2.5 billion plus annually treating people with illnesses directly linked to living in cold, damp and dangerous conditions. And as a consequence, severe respiratory disease like asthma, and might I mention mesothelioma and other asbestos-related diseases are on the increase, mainly in the most deprived areas. More and more people are sadly dying, Minister. Can you say how the government's levelling up policy plans to tackle this increasingly urgent health issue? Minister.
Thank you, Mr. Speaker. And the Honourable Gentleman raises a really important issue, and it's something that we're determined that we'll tackle. Housing is one of the key determinants of health, and a decent home can promote good health and protect from illness and harm. And we know, as the Honourable Gentleman said, that poor housing conditions have serious consequences for mental and physical health, and that's why we're determined, not just through the Levelling Up White Paper, but through the Health Disparities White Paper that will be published later this year, that will set out a bold ambition to reduce the gap in health outcomes and the actions that the government will be taking to address the wider determinants of health, including housing and the impact of poor housing on health.
Lynn Saxby.
Thank you, Mr. Speaker, and I thank my honourable friend for her answer. In North Devon, it's not just the quality of housing that's causing health issues, it's a lack of availability of affordable housing and a complete collapse of the private rental sector, which is delivering mental health issues amongst my constituents, but also means my much-loved North Devon Hospital is struggling to recruit as a local medical services. What steps is the department taking to try and address these concerns?
Minister.
Thank you, Mr. Speaker. And my honourable friend raised an important issue specific to her area and other areas that attract the people who go there for their holidays and perhaps not there on a permanent basis. But we're determined that through our white papers that we address every health inequality, whether it's caused by a population that is a movable population or whether it's a static population in the sort of areas that the honourable gentleman previously talked about.
Perkins.
Number 8, sir.
Minister.
Thank you, Mr. Speaker. Cancer treatment and diagnosis remained a top priority throughout the pandemic, with 4.4 million urgent referrals during the period and over 1 million people receiving cancer treatment. Thanks to the brilliant work of our NHS staff, first treatments for cancer have been maintained at above 94% of usual levels over the course of the pandemic. However, we do know fewer people came forward, and so we are now seeing record numbers of people coming through the system, with November last year having the highest number of 11,000 cancer referrals per working day.
Perkins.
Thank you, Mr. Speaker. I asked specifically about Derbyshire. I didn't get an answer in terms of that, but Derbyshire CCGs failed to reach any of the cancer referral targets for the most recent 12 months. And whilst this is a national failure, these shortages are particularly acute in Derbyshire. These failures have tragic consequences. My constituent, Paul Bryan's just 58. He's been attending his surgery for 2 years. He kept getting dismissed. He wasn't tested. And now the prostate cancer that was undiagnosed for all that time has spread to his ribs, to his spine, to his bones, and his diagnosis is terminal.
His family are urging the government to show more urgency to improve outcomes so that other families don't have to experience this needless heartbreak that they are. So can the Minister explain to the Bryans why the government rejected the workforce planning amendment to the Health and Care Bill, which could help our NHS get the cancer specialists it needs and prevent other families having this heartbreak like the Bryans?
Well, I'm sorry to hear about the case of the Bryan family, but can I reassure him in Derby and Derbyshire that the start of treatment within 31 days is at 92%, and that's despite record numbers of patients coming forward. And to tackle the very issue that he talks about getting people diagnosed earlier, because that's the key to getting more successful treatment, we are rolling out rapid diagnostic centres across the country so people can access screening and testing much more quickly and much more easily, and we have 159 of those live right now, with more to follow.
Davidson.
Number 9, Mr. Speaker.
Same state.
Mr. Speaker, personalised healthcare is a key priority in my reform agenda. I recently set out a new ambition that as many as 4 million people benefit from personalised care by 2024, covering everything from social prescribing to personalised support plans. And we are also on track to deliver 200,000 personal health budgets and integrated personal budgets by 2023-24.
Well, thank you, Mr. Speaker. I welcome the Secretary of State's answer. My constituents do still tell me that they are experiencing some delays beyond the NHS guidelines when it comes to diagnosis for special treatment. So what plans does my right honourable friend have to address, in particular, a lack of capacity and a need for capacity in specialty trained doctors and specialist diagnostic equipment to make personalised care a reality?
Same state.
My honourable friend is absolutely right to raise the importance of the workforce and medical equipment. He will be, I'm sure, reassured to know that the NHS today has more doctors and nurses working for it than ever before, with more in training than ever before, and we're investing record amounts in capital for new medical equipment, including investment in some 160 new community diagnostic centres, which will all include the latest state-of-the-art diagnostic equipment.
Adam Kaiser.
Number 10, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. NHS England has several bespoke services for veterans. This includes Op Courage, the Veterans Mental Health and Wellbeing Service, which provides a complete mental health care pathway for veterans. And veterans can benefit from personalised care plans, ensuring they can access support and treatment both in and out of hours. And as part of the care and support available to veterans, Op Courage works with military charities and local organisations to provide health with wider health and wellbeing needs, including drug and alcohol addiction.
Thank you, Mr. Speaker. My constituency of Airdrie and Shotts has a long military history, with many previously serving in the armed forces. And when I meet veterans from my constituency, we often discuss the mental health of veterans. And the war in Ukraine will undoubtedly have an immediate and lasting impact on the mental health of veterans, as they may be reminded of their experiences of war. So to help support our veterans, will the Department come forward with a package of emergency funding for armed forces mental health charities?
Minister.
Well, the Honourable Lady raises a very good question, and last year we committed an additional £2.7 million to further expand Op Courage following the recent events in Afghanistan. And NHS England has put in place several bespoke services and initiatives to meet the needs of our armed forces community. In addition to Op Courage, there is also the Veterans Trauma Network, the Veterans Prosthetic Panel and the Veteran GP Accreditation Scheme. But of course, with the ongoing events in Ukraine, of course, we will keep everything under review, and I'm very happy to meet with her to discuss further what may be required in this area.
We now come to Shadow Minister Dr. Rosanna Allen-Carr.
Thank you very much, Mr. Speaker. Our veterans have risked their lives for our country and deserve excellent mental health support. We must go even further. From the military frontline to frontline workers who have kept us safe, everyone deserves proper mental health provision. People have stepped up to protect our country and save lives during the pandemic. So is it any wonder then that teachers and NHS staff are so furious with the comments made by the member for Lichfield that they would go back to the staff room and have a quiet drink as a way to justify the indefensible actions of the Prime Minister? What does this say about the effect of mental health on our frontline staff? And will the Minister Please condemn these comments and apologise for the hurt caused by these remarks.
Minister.
I'm very happy to say that we, of course, thank very much all of the staff that have been on the front line, whether they're veterans, whether they're teachers, involved in everything that kept us going throughout the pandemic. And of course, the stresses and strains and the impact on mental health is something that we're very much aware of. There is additional support for mental health, and there will continue to be additional support with young people's mental health, with adult mental health. But of course, that's one of the reasons why we launched a call for evidence last week to inform a new 10-year cross-department mental health vision. And I would urge everybody actually to input into that process before it closes on the 5th of July.
Mr. Black.
11, please.
Thank you very much, Mr. Speaker. The workforce is the heart of our NHS, and I join with my honourable friend, and indeed I know with opposition members as well, in paying tribute and putting on record our thanks to those who work in the NHS. In the short term, the NHS has well-established processes to ensure the health service has the right number of staff with the right skills, alongside, of course, our investment in workforce expansion, including delivering 50,000 more nurses over the course of this Parliament. For the longer term, we have commissioned Health Education England to set out key drivers of workforce supply and demand. They're due to report this spring, and building on this, my right honourable friend, the Secretary of State, commissioned NHS England to develop a long-term workforce framework. We will share the conclusions in due course.
Kirsty Blackman.
Thank you very much. The anti-immigration hostile environment rhetoric and actions of this government means that it's having a significant impact on our NHS workforce, both in encouraging or not encouraging people to come here to work in our NHS, but also in discouraging current staff from staying here. The Health and Social Care Committee recommended that a national policy framework on migration to support national and local workforce planning be brought in. When will the government implement this recommendation?
Well, I'm very grateful to the honourable lady for her question. We are clear, and always have been clear, in how much we value the huge contribution that overseas workers in our NHS play in keeping our health service up and running and in delivering first-class care every day. There are three strands to our approach to building our workforce and increasing our workforce. One of them is increasing the numbers of people training in this country. A second is increasing retention, and a third is that workforce that comes from overseas and is incredibly welcome here. And I have to say that the number of people coming from countries outside of the EU into our NHS workforce has increased.
Anne-Marie Morris.
Thank you, Mr. Speaker. The Minister will be aware that the particular challenge for rural areas of developing a workforce plan are something which I have highlighted on a number of occasions. Indeed, the last report from the APPG on rural health and social care put forward 10 recommendations, which included how we might address the workforce planning issue in rural areas. Could the Minister advise me what steps he's taken to put in hand any of those recommendations to improve the plight of those living in rural areas?
Minister. Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend, who I know takes a close interest in this issue. She and I have discussed it on a number of occasions. And she's right to highlight the challenges that some more remote or rural communities can face in securing the workforce they need to meet their communities' needs. That is one of the things that I know that HEE work and subsequent workforce framework will be looking at across the whole range of geographies and the challenges faced by different geographies.
SNP spokesperson Martin Day.
Thank you, Mr. Speaker. The Scottish Government has recently bought Carrick Glen, a private healthcare hospital, in order for it to become part of the national network of treatment centres, which once fully operational will deliver capacity for over 40,000 additional surgeries and procedures each year. In contrast, the UK Government has taken the path of further privatisation of the NHS. So what recent assessment has the Minister made of the impact on workforce of further privatisation of NHS England?
Minister. Thank you, Mr. Speaker. Well, I'm grateful to the honourable gentleman. Had we been going further down the route of privatisation, perhaps the honourable gentleman's question might have had a little more resonance. What we have done in the NHS in England is investing in our workforce, investing in our national health service, while, of course, working closely with the independent sector to maximise the use of their capacity in parallel to make sure we bring down waiting lists and waiting times.
We now come to topicals. Lawrence Robertson.
Topical question number 1, Mr. Speaker.
Stay.
Thank you, Mr. Speaker. Our healthcare system is standing at a crossroads, and sooner or later we will have to make a choice between endlessly going back to the taxpayer to ask for more money and reforming the way in which we do healthcare in our country. Last month, I unveiled an ambitious new programme for reform, setting out how we are going to prioritise prevention, offer more personalised care, deliver improvements in performance and back the people making the difference in the NHS. The objective of this agenda, Mr. Speaker, is simple: to bring about the biggest transfer of power and funding in decades from our ever-expanding state to individuals, their families and their communities.
Robertson.
Thank you, Mr. Speaker. In Gloucestershire hospitals, 30% of patients do not medically need to be in hospital awaiting for discharge. That figure is twice the national average. Will one of the ministers contact the relevant people in the health service in Gloucestershire to ask them ways in which the government could help them to reduce that figure, because as it stands, lives are being put at risk?
Mr. Speaker, my honourable friend is right to raise this, and we are already in contact with the Acute Trust in Gloucestershire and some of the other trusts that are finding delayed discharge a particular challenge. My honourable friend will know that because of the pandemic, what has been a long-term challenge has become much more acute, not least because of the lost beds due to infection protection control and staff absences, both in healthcare and in social care. Our delayed discharge task force is making a difference. Numbers are coming down overall, but we will be working with Gloucestershire.
Secretary of State West Street.
Thank you, Mr. Speaker. Why does the Health Secretary think he has any licence to lecture the British people on their moral duty to pay taxes when he spent so many years avoiding his own?
Mr. Speaker, we want.
I'm not quite sure it's relevant to the question of topicals.
Responsibility of Secretary of State, not personal.
Yeah, the question's meant to be
I'm very happy to answer, if you allow me, because look, the honourable gentleman, he could have asked me a question on anything to do with health and care, anything he wanted, but instead he chooses to talk about my personal affairs before public life. That was his choice. He could have asked me, Mr. Speaker, he could have asked me about the COVID backlogs that he pretends that he cares so much about. He could have asked me about how, perhaps given me suggestions.
Order. Secretary of State, just say, I've got it. There's your questions and your responsibilities. No, we can have another try. West Street.
Thank you, Mr. Speaker. I'd just say to the Secretary of State, be careful what you wish for. I hope he will at least reply to the letter I sent him last Thursday. I'll place a copy in the library of the House. He's been stonewalling journalist questions, but since he says he wants to talk about the government's record, let me ask him about that instead. Because we went into the pandemic with NHS waiting lists already at 4.5 million. We went into the pandemic with NHS staff shortages of 100,000. We went into the pandemic with social care staffing vacancies of 112,000. So it isn't just the case the Tories didn't fix the roof while the sun was shining. They dismantled the roof, removed the floorboards, and now they have no plan to fix it. So where is the Secretary of State's plan to fix the NHS crisis?
Once again, I'll remind that topicals are short and punchy, not lengthy statements rather than a question. Now, I just want to say there's a lot of backbenchers on both sides who deserve to get in, who want to raise constituency matters. Please, let's give them time. I don't want a lengthy fallout, and they are health questions. Secretary of State.
Mr. Speaker, you've been very generous to the honourable gentleman, but another try you gave, but another failure in asking a question. Again, he's not talking about the serious issues, and it shows once again that he will play petty party politics. Labour has no plan for the challenges that this country faces.
Can I just reassure the Secretary of State for Health? I wasn't being generous. The actual Shadow Secretary of State did have 2 questions, so I've not been generous in any shape, way or form. Mark Fletcher.
Mr. Speaker, we've all seen the disturbing scenes in Shanghai recently, and does my right honourable friend agree that this shows how dangerous a zero-COVID strategy is, and that we were right to open up this country and to rely on our vaccines as the safest way out of the COVID situation?
Mr. Speaker, like many across the House, I've been deeply disturbed by the reports that we've all seen from Shanghai, and my thoughts are with the people that are affected. It does show what dangerous fallacy this whole idea of zero COVID was, and it does also show the fact that we are the most open country in Europe, that we've got the big decisions right. We didn't listen to the party opposite when they said we shouldn't open up in the summer. We didn't listen to the party opposite when they said in the winter, again, calling for restrictions. We are showing the world in how to live with COVID.
Thank you, Mr. Speaker. My constituents are being forced onto private and unaffordable dental plans or wait up to 5 years to see an NHS dentist. The situation is getting worse and worse. So I've met with the groundbreaking Hull and York Medical School to see if they can assist with training a future generation of dentists. They are keen to help. So what is the Minister doing to work with medical schools?
Well, we're going to get others in.
I thank the Honourable Lady for her question. We have met to discuss this previously. I'm happy to discuss with Health Education England to see if one of their centres for dental development could be suitable for her constituency.
Peter Byrne.
In 2019, Kettering General Hospital, which serves my constituency, was promised £46 million for a major upgrade. 3 years later, the hospital still hasn't got the money. Secretary of State, can you go out and buy a very, very, very big pair of scissors, cut through the red tape and get it sorted?
Well, I'm grateful to my honourable friend. No one, with possibly the exception of the honourable member for Kettering, is more passionate about seeing the improvements at his local hospital delivered, and I had the pleasure of visiting. The £46 million, he will know, was allocated originally for an urgent treatment centre. The hospital asked that that be changed, and it folded in with the overall programme. They have yet to submit a business case for the enabling works. When they do, I will ensure it is expedited.
Lloyd.
Thank you, Mr. Speaker. The gap in life expectancy between people living in the richest and the poorest areas is once again growing. That affects my constituents directly. I've heard nothing today that tells me what the Secretary of State is going to do to narrow that gap. So, Secretary of State, what will you do to protect my constituents?
Mr. Speaker, the honourable gentleman knows that I know his constituency well. It's my birthplace, and he may know also just a couple of months ago I visited his constituency and I met with members of the local community at the Deeplish Community Centre to talk about exactly what he's rightly raised today, the importance of tackling inequalities in Rochdale and beyond, and that will be set out, our plans, in our upcoming health disparities white paper.
James Sunderland.
Mr. Speaker, thank you. The CAS Review interim report found that to date there's a profound lack of evidence on the best approach to treat gender dysphoria in children. Does my right honourable friend share my concern that in spite of this, the NHS insists on making a child's expressed gender identity the start point for treatment, and also my surprise that the NHS has chosen so far not to track patient outcomes, particularly for under 18s?
Mr. Speaker, I do share my honourable friend's concerns, and that is why the NHS commissioned this review from one of our top paediatricians. It is already clear to me from her interim findings and from the evidence, other evidence that I've seen, that the NHS services in this area are too narrow, they are overly affirmative, and in fact they're bordering on ideological. And that is why in this emerging area, of course, we need to be absolutely sensitive, but we need to make sure that there is holistic care that's provided, that there's not a one-way street, and that all medical interventions are based on the best clinical evidence.
Bill Rivera.
Thank you, Mr. Speaker. Since February 2020, my local borough of Lambeth has seen a 14% drop in dementia diagnosis. Now, that just means that people aren't getting the support that comes with diagnosis. We also know that so far none of the announced £8 billion backlog funding has been dedicated to addressing the stagnation of diagnosis rates. So can the Secretary of State explain to us exactly what they're going to do to make sure that people are getting diagnosed on time?
The Honourable Lady raises a very important question. We want a society where every person with dementia, their families and carers receive high-quality care, compassionate care from diagnosis through to end of life. We have provided £17 million this financial year to NHS E&I to increase the number of diagnoses. And this funding was spent in a range of ways, including investing in workforce to increase capacity in memory assessment services.
Speaker,
the Secretary of State will have read the scandal exposed in the Sunday
Sunday Times this weekend that 6 babies are being born every month after being exposed to sodium valproate, which has been known for many years to cause disabilities. Last year, the government consulted on putting warning labels on valproate. Is it not time to go much further and ban the prescription of sodium valproate to epileptic pregnant mothers?
Mr. Speaker, my right honourable friend is right to raise this, and many of us would have seen the recent reports on this, especially from the families affected. It is right that we reconsider this and that we make sure that whether it's sodium valproate or any other medicines, that they are only given in the clinically appropriate settings.
Toby Perkins.
Thank you, Mr. Speaker. The Secretary of State is right that there's many important health matters that we all want to get to the bottom of, and we don't want his, as what he described, personal affairs to get in the way of that. So would he, in order to ensure this House concentrates entirely on those matters, welcome the HMRC investigating whether he was claiming non-dom status on a solely...
Order. Let's move on. What a waste of a question. Jenna Davidson.
Thank you, Mr. Speaker. I'll try not to make this one a waste. I was very grateful to the Minister for meeting me to discuss my ongoing campaign to restore the A&E to Bishop Auckland Hospital. Many of my constituents face huge drives to get to Darlington or Durham, and given that swift treatment can be a significant factor in outcomes for a number of conditions like strokes and heart attacks, would you agree with me that having A&E services spread geographically rather than just in strong population centres is an essential part of keeping our community safe?
Hear, hear.
Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend. I did indeed have a very positive and constructive meeting with her. It's absolutely right that we have access geographically spread to A&E services, but these decisions are quite rightly taken by clinical commissioners on the basis of clinical evidence. But I know she will continue fighting the corner for the reopening of her local A&E with tenacity and passion.
Dodson.
Mr. Speaker, the 10-year cancer plan the Secretary of State has announced is a key opportunity to ensure that future services are designed with the patient at its core, especially for those living with cancer. What steps is his department taking to engage with underrepresented groups in the development of the 10-year cancer plan? And will you agree to meet with Macmillan Cancer Support to discuss how they can support in this key area?
Mr. Speaker, I would pleased to have that meeting that the Honourable Lady has suggested, and she should know the 10-year cancer plan. We've just closed the consultation. There's been a fantastic response to the consultation. She may also have seen the announcement we made today around the lung cancer health checks, and it's with improvements like that we intend to do a lot more.
Edwards.
One of the best ways to maximise NHS capacity is to increase people's access to GP appointments and treatments like mental health services and physiotherapy in their own community. So would the Minister join me in backing our bid for a new health centre in Eastleigh and in calling on Nottinghamshire's Clinical Commissioning Group to prioritise funds for this vital service?
I thank the Honourable Lady for her question. I did an excellent visit to the surgery in Eastleigh, and I look forward to the business case being submitted so we can look at it further. She's quite right. Investing in primary care does a huge amount to support the health of the local community.
Ellen Days.
Thank you very much, Mr. Speaker. A survey by the charity STEM4 has found that 95% of GPs believe CAMS services are in crisis, with children and young people waiting up to 2 years for treatment after referral. Will the Secretary of State stop treating children as an afterthought and act to provide open access mental health hubs for young people in every community to put an end to these agonising waits?
The Honourable Lady raised a very important point, and I know that children's mental health services are treating more young people than ever. However, the demand has quadrupled since the pandemic, and we know that's why we've invested £79 million in these services, and by 2023-24 an extra 345,000 more young people will be accessing support. I mentioned the call for evidence. I think it is very important that we work through our vision for our 10-year plan. We're also introducing mental health support teams in schools, which will help, plus access to community and mental health hubs, and more young people access to eating disorder services, but there's a lot of work ongoing.
Thank you, Mr. Speaker. I know from discussions with constituents that needle phobias are a real thing. Can my right honourable friend therefore tell the House what support the government is giving to intranasal vaccine delivery systems to ensure that the maximum number of people take up the vaccine?
Thank you, Mr Speaker. The Department for Health and Social Care commissions research through the National Institute for Health and Care Research, which the UK Research Innovation has co-funded in the Imperial College London study worth £580,000, looking specifically at the safety and effectiveness of 2 COVID-19 vaccines administered via the respiratory tract. This study is ongoing, but in later stages of the Phase 1 clinical trial, and results will be made public in due course and following peer review.
Thank you, Mr. Speaker. Those doing social care often work long hours as a real lifeline for the most vulnerable. Will the Minister act to ensure those in social care are paid properly and paid a real living wage, as Citizens UK is campaigning for?
I thank the honourable gentleman. Actually, according to Skills for Care data from 2020-21, the majority of care workers were paid above the national living wage in that year. Most care workers are employed by private sector providers who pay their terms and conditions. However, we are committed, and we have committed £1.36 billion to Market Sustainability and Fair Cost of Care Fund, which will support local authorities to move towards paying providers a fair cost of care, which we hope will lead to better sustainability and better staff.
Thank you, Mr Speaker. At Prime Minister's questions, I have raised a local campaign for a specialist menopause clinic in Devon. I'm pleased the Minister has agreed to meet with me. Will my right honourable friend encourage local NHS leaders to fund specialist menopause services?
I thank my honourable friend for his question. The Government recognises that menopause services are needed to improve, which is why that menopause is a priority area in our women's health strategy. We also recognise that it's often best provided in primary care, but some women do need some specialist services, and we are looking at this in our women's health strategy and also the menopause task force as well.
Kate Osborne.
Mr Speaker, in December last year, the Department of Health and Social Care promised 3 urgent actions to tackle the gender health gap: the appointment of a Women's Health Ambassador, legislation to ban hymenoplasty, and that the Women's Health Strategy for England would be published in the spring of 2022. So can I ask the Minister, when are these vital actions actually going to happen?
I can let the Honourable Lady now know that interviews have taken place for the Women's Health Ambassador. We're expecting an announcement on the appointment any day now, and we will be publishing the Women's Health Strategy in the coming weeks.
Sir David Evans.
Mr Speaker, can I welcome all my right honourable friend is doing to address health inequalities. However, could I ask him to look carefully at public health funding for my borough of Bexley, whereas we're seriously underfunded compared to similar boroughs in London?
I'm very pleased to meet with my honourable friend and to discuss that further, and I'm sure also he will welcome the publication of the upcoming Health Disparities White Paper.
Final question, Kibblin Peter.
Thank you, Mr Speaker. In a recent survey by Carers UK, almost half of unpaid carers said that they are currently unable to manage their monthly energy bills and expenses, and any further increases will negatively affect their own physical and mental health or that of the person they care for. So what steps are being taken, along with the Secretary of State for Work and Pensions, to support these hard-working, exhausted, unpaid carers with the cost of living?
I thank the Honourable Lady for her question, and of course we have a great deal of gratitude for every unpaid carer. Around 360,000 carer households on universal credit can receive an additional £2,000 a year through the carer element. The weekly rate of carers allowance increased to £69.70 in April 2022, and we've also had a real terms expenditure on carers allowances forecasted to increase by around £1.3 billion. In addition, there are a big focus in our reforms and our white paper to focus on what more we need to do to support unpaid carers.
We now come to the statements, in which I will call the Home Secretary. Home Secretary Priti Patel.
Thank you, Mr Speaker. With permission, Mr Speaker, I'd like to make a statement on the United Kingdom's approach to the global migration challenge. The United Kingdom has a long and proud history of offering sanctuary to refugees. In recent years alone, we have welcomed more than 185,000 people through safe and legal routes, including from Syria, Hong Kong, Afghanistan, and more recently, Ukraine. In addition, we have welcomed more than 40,000 people in recent years through our refugee family reunion routes. This government has done more than any other in recent history to support those fleeing persecution, conflict or instability. But we cannot focus our support on those who need it most or effectively control our borders without tackling illegal migration, which, Mr. Speaker, is facilitated by people smugglers, serious organised criminals that profit from human misery, who do not care about people drowning in the Channel or suffocating in the back of containers. We must break their lethal and evil business model by removing the demand for their repugnant activities. This type of illegal migration puts unsustainable pressures on our public services and local communities. Every day, the broken asylum system costs the taxpayer almost £5 million in hotel accommodation alone. The cost of the asylum system is the highest in over 2 decades at over £1.5 billion. And as the Prime Minister, Mr. Speaker, said last week, we cannot sustain a parallel illegal system. Our compassion may be infinite, but our capacity to help people is not. But this is why the new plan for immigration and its legislative vehicle, the National Anti-Borders Bill, are so vital. And once again, I urge honourable members, but also members in the other place, to follow this elected House in backing the bill. At the heart of this government's approach is a simple principle, Mr. Speaker: fairness. Access to the UK's asylum system should be based on need, not on the ability to pay people smugglers. Mr. Speaker, more than 80 million people around the world are displaced. Others are on the move because they want a better life. There is a global migration crisis that demands innovative and international solutions, and this government is taking firm action. When I published the new plan for immigration back in March last year, we set out 3 very clear objectives: to increase the fairness and efficacy of our system so that we can better protect and support those in genuine need of asylum; to deter illegal and dangerous routes of entry to the UK, thereby breaking the business model of criminal smuggling networks and protecting the lives of those they endanger; and, Mr. Speaker, to remove more easily from the UK those with no right to be here. The Ministry of Defence has taken command of small boat operations in the Channel. Every small boat incident will be investigated to determine who piloted the boat and could therefore be liable for prosecution. These reforms are a truly cross-government effort, including the Home Office, the MOD, the Crown Prosecution Service, Border Force and the Ministry of Justice. A nationwide dispersal system will be introduced so that asylum pressures are more equally spread across local authorities. Currently, 53% of local authorities in England, Scotland and Wales do not accommodate asylum seekers under the dispersal system. It is simply unfair that a national burden should be felt disproportionately by certain areas of the country. For the first time, Mr. Speaker, the government is building asylum reception centres to end the practice of housing asylum seekers in expensive hotels. A new reception centre in Linton upon Ouse in North Yorkshire will open shortly. Far from being outlandish, as some of the opposition have commented, asylum reception centres are already operational in safe EU countries such as Greece, Mr. Speaker. And, Mr. Speaker, they are funded by the EU. And just last week, I signed a new world-leading migration and economic development partnership with Rwanda. Under this partnership, those who travel to the UK by illegal and dangerous routes, including by small boats across the Channel, may be relocated to Rwanda, where they will have their asylum claims considered. Those in need of protection will be given up to 5 years of support, including education and employment training, help with integration, accommodation, healthcare, so that they can thrive there, Mr. Speaker. The UK is supporting this investment in Rwanda over 5 years, boosting the Rwandan economy and increasing the opportunities of people living there, further cementing the trading and diplomatic relationship between our countries. Mr. Speaker, this is a bespoke international agreement reached last week with Rwanda. I came to Parliament as soon as was reasonably practical following the conclusion of that agreement. This agreement is comparable with all our domestic and international legal obligations. Rwanda is a state party to the 1951 United Nations Refugee Convention and the 7 core United Nations Human Rights Convention, and has a strong system for refugee resettlement. The United Nations has used Rwanda for several years to relocate refugees, Mr. Speaker. And, of course, Mr. Speaker, it was the European Union who first funded this. This agreement deals a major blow to the people smugglers and their evil trade in human cargo. Everyone who is considered for relocation will be screened and interviewed, including an age assessment, and have access to legal services. Mr. Speaker, in relation to accounting officer advice, contrary to reports in the newspapers, the Permanent Secretary did not oppose this agreement nor assert that it is poor value for money. Rather, he stated in his role as accounting officer that the policy is regular, proper and feasible, but there is not currently sufficient evidence to demonstrate value for money. It is the job of ministers to take decisions, Mr. Speaker, and it is the job of ministers, Mr. Speaker, more often than not, to take tough decisions in the interest of our country. Existing approaches, Mr. Speaker, have failed, and there is no one single solution to tackle these problems, something that I think the benches opposite may have encountered in the past as well. Change is needed because people are dying attempting to come to the UK on illegal and dangerous routes. This partnership is a type of international cooperation needed to make the global immigration system fairer, keep people safe and give them opportunities to flourish. This will help break the people smugglers' business model and prevent the loss of life while ensuring protection for those who are genuinely vulnerable. This government is delivering the first comprehensive overhaul of the asylum system and this type of illegal migration in decades. At the heart of this approach, Mr. Speaker, is fairness. Access to the UK's asylum system must be based on need, not the ability to pay people smugglers. And the demands on the current system, the cost of British taxpayers and the scandalous abuses are increasing. The British public have rightly had enough. Our new plan for immigration will improve and support those directly fleeing oppression, persecution and tyranny through safe and legal routes. It will deter illegal and dangerous routes of entry to the UK, make it easier to remove those with no right to be in the UK, and, Mr. Speaker, provide a common-sense approach to controlling immigration, both legal and illegal. I commend the statement to the House.
I call the Shadow Home Secretary, Yvette Cooper.
Thank you, Mr. Speaker. We've seen over the last week, Mr. Speaker, this unworkable, shameful and desperate attempt to distract from the Prime Minister's law-breaking that the Home Secretary should not go along with because she is undermining not just respect for the rule of law, but also her office by providing cover for him. The policies that she has announced today are unworkable, unethical and extortionate in the cost for the British taxpayer. There's no information from the Home Secretary about the costs today. Will she admit the 120 million she's announced doesn't pay for a single person to be transferred? She hasn't actually got an agreement on the price for each person. In fact, the £120 million is the eye-watering price the Home Office is paying just for a press release. So what's the rest of the cost? What is this year's budget? How many people will it cover? The Home Office has briefed it might be £30,000 per person to cover up to 3 months accommodation, but that is already 3 times more than the ordinary cost of dealing with an asylum case in the UK, and her statement says she's going to provide 5 years of cost. Well, in Australia, offshoring costs £1.7 million per person. That is over 100 times more than the ordinary asylum cost from here. So where is all the money going to come from in order to fund this plan? She says she's going to save money on hotels, but the only reason we're paying a fortune in hotel costs is because the Home Office decision-making has totally collapsed. On her watch, Home Office are only taking 14 18,000 initial asylum decisions a year. That is half what they were doing 5 years ago, half. Taking fewer decisions than Belgium, Netherlands, Austria, never mind France and Germany. So the costs to the UK taxpayer have soared by hundreds of millions of pounds because she isn't capable of taking the basic asylum decisions. And because she's not capable of taking those decisions, she is trying to pay Rwanda to take those decisions instead. Whether people are refugees or not, whether they are victims of modern slavery or not, whether they have family in the UK, whether they've come from Afghanistan, Syria or even Ukraine. She is asking them to do the job that she is not capable of. She says it will deter boats and traffickers, but the Permanent Secretary says otherwise. He says there's no evidence of a deterrent effect, and there has been a total failure to crack down on criminal gangs that are at the heart of this problem. The prosecutions for human trafficking, for non-sexual exploitation, are down from 59 in 2015 to just 2 in 2020. Just 2. Well, the criminals won't be deterred because someone they exploited was sent to Rwanda. They don't give money-back guarantees, which means they lose money if their victims end up somewhere else instead. They will just spin more lies, and she is totally failing to crack down on those criminal gangs. So why not get on with her basic job instead? Properly crack down on human traffickers. Do the serious work with France and Belgium to prevent the boats setting off instead. She didn't even mention in this statement, and make decisions fast. The Home Secretary is just using this policy to distract from years of failure. She promised 3 years ago to halve the number of crossings, and instead they have increased tenfold. And this will make it worse for trafficking. The top police chief and modern slavery commissioner has said her legislation will make it harder to prosecute traffickers. When Israel tried paying Rwanda to take refugees and asylum seekers a few years ago, independent reports showed it increased people smuggling and increased the action of the criminal gangs. And that is the damage she is doing. She is making it easier for the criminal gangs and harder for those who need support. At a time when people across our country have come forward to help those who are fleeing Ukraine, to help desperate refugees, instead of working properly with other countries, the Home Secretary is doing the opposite. All she is doing is making it easier for the criminal gangs. So will she tell us the facts, the real costs of this policy, the real damage it's going to do to human trafficking and people smugglers, and come clean with the public and come clean with the House?
Home Secretary.
Thank you, Mr. Speaker. Well, Mr. Speaker, I should just say that response was just somewhat wholly predictable, if I may say so. And I think it's important just to say to everyone in the House right now, you cannot put a price on saving human lives. And I think everyone will respect that completely. And, Mr. Speaker, if I may, the Honourable Lady was a minister in the Blair government when the powers that have given this government to undertake the legal basis of this policy were introduced back then. And I don't remember the current Home Secretary, Shadow Home Secretary, exploding in this synthetic rage when she occupied a seat in the Blair government, when all those policies were put in action. And those, Mr. Speaker, were acts passed in 1999, 2002, 2004 for partnerships in this similar way. By the way, the same partnerships and that were used to put in place the Dublin regulations to return inadmissible asylum seekers to EU member states. And of course, the Honourable Lady has gone on the record multiple times to attack the government for leaving those regulations, while at the same time calling for a replacement to be put in place. Now she's attacking the government for using the very powers that only a few weeks ago she was saying that we still could be using if we hadn't left the EU. I think, quite frankly, Mr. Speaker, what we've seen today from the party opposite and from the Honourable Lady is, quite frankly, their absolute inability to understand this issue, this differentiation between legal migration and illegal migration. They should be honest about their policies. Their position is to stand for open borders and uncontrolled immigration. And, Mr. Speaker, if I may just go even further, I mean, she speaks about the policy being unworkable and then extortionate. Well, if the policy is unworkable, it can't then be extortionate, because we'll be making payments based on delivery. And this is the point about our scheme, that there is nothing that she has said today that actually puts an alternative forward, that actually seeks to deal with the issue of people trafficking, deaths in the Channel, and importantly, I think the Labour Party being exposed today for having no policy, no idea as to stop people smuggling.
Theresa May.
Thank you, Mr. Speaker. Can I say, with respect to my right honourable friend, that from what I have heard and seen so far of this policy, I do not support the removal to Rwanda policy on the grounds of legality, practicality and efficacy. But I want to ask her about one very specific issue. I understand that those who will be removed will only be young men, that families will not be... well, the Home Secretary is shaking her head, so I've obviously misunderstood the policy in that sense. But if it is the case that families will not be broken up, and the Home Secretary is nodding, does she not believe, and where is her evidence, that this will not simply lead to an increase in the trafficking of women and children?
Mr. Speaker, I'm very happy to meet with the Right Honourable Lady to discuss this further and actually give her further information on this. No, actually calm down and listen. I think first and foremost, just on the policy is legal and there's been a published MOU that speaks very, very clearly, well, you're not even listening, so there's no point to it. That spells out the MOU very clearly in terms of the legal. If you're interested in listening to responses, then please do. That there is an MOU that has been published which spells out in full detail the legalities, but also the nature of the agreement. Now, I think the Right Honourable Lady would respect the fact that I'm not going to come to the floor of the House and speak about the eligibility criteria, because she will know. Because actually, if I may say so, Mr. Speaker, the Right Honourable Lady will know very, very well that actually it's that type of criteria that is used by the smuggling gangs to then effectively exploit various loopholes in our existing laws when it comes to various issues such as legal action that is undertaken to prevent removals, some of which, if I may, Mr. Speaker, just add, there are many members opposite that write letters to me frequently to say, please don't remove some of the failed asylum seekers, but also foreign national offenders, people that have actually got no legal basis to remain in our country. But I'd be happy to meet with the Right Honourable Lady on
Spokesperson Stuart C. MacDonald.
Here. Thank you, Mr. Speaker. Mr. Speaker, this is a cruel and a catastrophic policy. It will not hurt smugglers, but will further seriously harm people who have fled persecution. It will do untold damage to the international system of refugee protection and to what little remains of the UK's reputation for upholding international law. Mr. Speaker, this is worse than temporary offshoring. It is offloading of responsibility altogether. As the UNHCR has said, people fleeing persecution should not be traded like commodities. And in the words of the Refugee Council, this is nothing short of cash for deportations. 85% of refugees are in developing or the least developed countries already. Here is a wealthy UK offering cash to take some more. So much for global Britain. Mr. Speaker, the only thing that's transparent about this policy is its dodgy timing and grubby political motivation. So, in the interests of proper transparency, will she finally publish a detailed estimate of how many billions this policy will cost? She was chuntering that she had the deal all sorted out. She can now announce it to members of this House. And for what are we paying this money? Can she say what percentage of asylum seekers coming to the UK will be subjected to this abysmal treatment? Reports from Rwanda suggest capacity probably around 1%, but certainly less than 5%. Is that correct? We are told that people will be screened before transfer, but how can a pathetic screening interview possibly pick out trafficking survivors or torture victims or LGBT people? Quite simply, it can't. So is she happy to see these people subjected to this treatment? And why are women and children within the scope of this policy? And will people going through that screening process be able to access legal advice?
Oh, yeah, I doubt it.
Mr. Speaker, why aren't we allowed to see the criteria for deciding who will be sent? Where is the transparency in that? And how will she monitor their treatment? Her government has completely failed to stop abuses in UK detention centres, never mind centres that are 5,000 miles away. So, Mr. Speaker, in short, this disastrous policy has nothing to do with the global migration crisis. It has everything to do with it distracting from the PM's political crises, and it is absolutely sickening for all of that.
Well, Mr. Speaker, if I may, just for the record, I actually think the Honourable Gentleman's latter comment was absolutely unacceptable. And actually, if I may, it does a great disservice, not just to members, not just to this government and officials that have worked for over 9 months on this partnership, but also to our counterparts in the world in Rwanda that have been working with us, and many of my own international counterparts as well, that are working collectively together to tackle issues of illegal migration and and if I may say so, some counterparts in the EU as well. And if I may, just to answer some very, very specific points, I think it is shameful that he is playing party political games on that point, just like the party opposite as well. No, absolutely not. If you want to let me answer the question and finish, I will. I think the other point to make, Mr. Speaker, is Rwanda. Rwanda actually is home to resettling over 130,000 refugees, and they have done that successfully. And if I may, I think your comments are a slur to the successful efforts of our partners in Rwanda. Rwanda is a safe and secure country with the respect for the rule of law. And no, absolutely not. I actually think members should just listen to the undercurrent of their tone towards the country of Rwanda, which has done a great deal to provide safety and refuge and security and a new life to many, many refugees around the world. He asked about the approach that would be taken. Everyone considered for relocation will be screened, interviewed and have access to legal advice. Decisions are made on a case-by-case basis, and nobody will be removed if it's unsafe or inappropriate for them at all. Now, I also, if I may, Mr. Speaker, I'd just like to conclude by making another point as well, because he is not the first honourable member to mention legal obligations and the legalities of this. Rwanda, like us, is beholden to the same legal obligations as the United Kingdom on human rights. And if I may, I just want to make the point again. I think there is something really, really quite unpleasant about the undercurrent of the tone that is taken to Rwanda from colleagues.
Gary Sambrook.
Oh, sorry, Mr. Speaker, I didn't hear. In latest figures suggested, Mr. Speaker, in Birmingham, over 7,000 people in December were claiming asylum support, amounting to tens of millions of pounds. Does my right honourable friend agree with me that this plan and partnership with Rwanda will reduce the reliance on hotels and bring down small boat crossings?
Oh, I thank my honourable friend for his question, and I think actually there are a number of things. If the honourable lady wants to be less hysterical and actually listen, she might actually learn something about the new plan for immigration. I think it is important to reflect, Mr. Speaker, on a number of points. The answer to my honourable friend is absolutely yes, because we do not want people in hotel accommodation. And of course, it's a cheap point for the opposition benches to make, but with the pandemic, we absolutely had to use hotel accommodation as part of dispersal to actually keep people protected during the pandemic. That was a fact, and Public Health England guidance spoke to that. And of course, on decision-making, yes, of course, and on decision-making, if you choose to listen, that's exactly what the new plan for immigration is about, in terms of speeding up asylum decision-making and processing with this legislation and digitalisation of the system. And I have to add, Mr. Speaker, of course, every single member on the opposite benches have voted against this policy. They clearly want open borders. They just want to have uncontrolled migration, and they've done nothing themselves to come up with an alternative plan on this issue.
Chair of the Select Committee, Dame Diana Johnson.
Thank you, Mr. Speaker. The announcement made last week when Parliament wasn't sitting has caused a great deal of confusion around what this policy actually entails. Unfortunately, the Home Secretary turned her head away from the microphone when she was responding to the Right Honourable Lady for Maidenhead. So I wonder if the Home Secretary could answer the question about who would actually be eligible to be sent to Rwanda. Is it going to be single young men? Is it going to be women and children? And what percentage of asylum seekers does the Home Secretary think will be sent to Rwanda?
Mr. Speaker, just on the on eligibility, as I have already said, everyone considered for relocation will be screened, interviewed, have the right access to legal advice and services, and decisions will be made on a case-by-case basis. That is absolutely right and proper. But there is also the fundamental principle right now in relation to this policy and the new plan for immigration, which I'm sure she is well versed in, is that this will apply to people that are inadmissible to our asylum system and people that have come to our country illegally through illegal and dangerous routes.
Kevin Hollinray.
Mr. Speaker, the Asylum Reception Centre my right honourable friend refers to is situated in my constituency of Linton and Ouse. I am not a NIMBY in any shape or form, but nevertheless, this is a small rural village. It is the RAF base it's going to be situated on is right in the centre of that village. There are understandable concerns from local people that this is not the appropriate place to put such a reception centre. Would my right honourable friend meet with me to discuss the decision and see what can be done?
Absolutely, and if I may, Mr. Speaker, I just want to thank my honourable friend as well, because he has been in dialogue with ministers on this issue. I'd be very, very happy to meet with him, and of course he does understand the principle behind all of this, so I'm very happy to discuss this with him further.
Diane Abbott.
The Home Secretary asserts that Labour members do not understand the issue, but she will be aware that a former permanent secretary at the Home Office, Sir David Normington, said last week about her Rwanda policy that it's inhumane, it's morally reprehensible, it's probably unlawful, and it may well be unworkable. How does she come to know better than a former Home Office Permanent Secretary?
Mr. Speaker, if I may tell the Right Honourable Lady, I'm surprised the Right Honourable Lady is using Sir David's name in vain, given it was also a former Labour Home Secretary who infamously and discourteously described the Home Office leadership and management at the time as not fit for purpose during Sir David's tenure. If I may, things have moved on in terms of the asylum in terms of the asylum system right now, which is why the new plan for immigration, which her party and members on the opposite benches continuously vote against, have no plan to deal with these important and difficult issues, and at the same time will bring in the reform that our country needs, while making sure that we preserve the efficacy of safe and legal routes for people that are fleeing persecution to come to our country and get the support that they need.
Mitchell.
Thank you, Mr. Speaker. My right honourable friend deserves great personal credit for seeking to tackle this dreadful crisis which exists in the Channel. But will she accept that many of us have grave concerns that the policy she has announced simply will not work? On the subject of cost, can she confirm that she will not be using expensive military aircraft to make this 9,000-mile round trip? And on the subject of cost also, will she ensure before the House of Commons votes on this matter tomorrow that we know the cost per asylum seeker of those she is sending to Rwanda?
Well, Mr. Speaker, my honourable friend, right honourable friend, who knows Rwanda as a country incredibly well, if I may say so, and we've had many discussions in the past about Rwanda. I'm very happy to meet with him and have further discussions with him as well. We will not be using military planes for any removals, but he will also, and actually many members of this House will be pretty familiar with the approach that we do take to removing failed asylum seekers and foreign national offenders, to either returning them to their country of origin or to third countries. There is a whole process around this, which is a lot of operational work and details that take place. So I'm happy to talk to him privately about that, because these are complicated ways in which we can do this. And if I may, Mr. Speaker, the right honourable gentleman makes further points that I'm very happy to discuss with him as well.
Live effort.
Mr. Speaker, can the Home Secretary say whether she's negotiated a cap on the cost of this arrangement with Rwanda? What will be the cost per person sent, and whether there's a limit on that cost? If so, what is it?
Mr. Speaker, in terms of costs, as I've already published and said, there is an upfront £120 million development cost. And with that, of course, when we remove people, payments will be made accordingly, only once we've removed people to Rwanda.
Dame Andrew Lentz.
Thank you, Mr. Speaker. I'm incredibly proud of this country and this government's track record in providing safe welcome to over 185,000 asylum seekers and refugees since 2015. And I do hope my right honourable friend will be ramping up the welcome for Ukrainian refugees. I know she'll be working flat out at it. But what I do find absolutely abhorrent and inexplicable is the way that many on the opposition benches, and in fact even in the top echelons of the Church of England and in other faiths, who have completely forgotten the images of children lying drowned on our beaches. How can they not seek to try and remedy that appalling situation? These are not refugees and asylum seekers. They are coming from France.
I thank my right honourable friend for her comments and observations. And first of all, Mr. Speaker, my right honourable friend will be very, very well aware of the work that our noble friend Lord Harrington is doing in the other place on the Ukrainian scheme right now, in terms of resettling and bringing people over for the Homes to Ukraine scheme. If I may, Mr. Speaker, the left in particular, they like to preach compassion, but there is little compassion when they do not have the backbone to actually make difficult decisions when it comes to the protection of human life. And if I may, Mr. Speaker, for months and months and months, they talk about saving lives and lost lives. And now that there is the prospect for action to save lives and to go after the evil people smugglers, they wring their hands and they choose to play party political games.
Thank you, Mr. Speaker. Members across this House are desperately concerned about the children who are often on these boats. So can we have a straight answer from the Home Secretary? Does she intend for one of the criteria to be that prevents somebody being sent to Rwanda to be being under 18? And crucially, where will the processing and the decision-making as to whether or not somebody is under 18 take place? Please, Home Secretary, be straight and honest with us what you intend to do with these children. We all deserve better.
First of all, Mr. Speaker, if I may, I've already spoken about the processing and the eligibility. Yes, I have. I absolutely have. And operational decisions are for the officials and the practitioners on the ground that undertake them. And that is part of our process that she should respect.
Peter Bone.
Mr. Speaker, I think the Shadow Home Secretary was slightly wrong when she talked about human trafficking. This isn't human trafficking, this is people smuggling. This is where evil gangs are paid money to take people across the channel. They don't care about the lives of these individuals. And the only way you're going to stop the people smuggling is if you reduce the demand for it. And the Home Secretary's Rwanda policy is absolutely right. Would you agree with me that her policy is morally the right thing to do?
My honourable friend is absolutely right. There is a distinction and a significant difference between people trafficking and smuggling. It is the smuggling gangs, the people smuggling gangs that we are trying to stop. We are trying to break up their business model and end their evil trade, and it's absolutely right that we do so. And when it comes to cases of human trafficking, it is a well-known fact, and in fact it is down to the work of my right honourable friend, the member for Maidenhead, and the work with the Modern Day Slavery Act, and the work of this government that actually has stood up the legalities and the proper processes to give those people that have been trafficked the legal protection and the safety and security that they need in our country.
Mr. Carmichael.
Thank you, Mr. Speaker. Can the Home Secretary tell the House how many people does she expect to send to Rwanda in the first 12 months of this scheme? She will be aware that Rwandan government ministers are on the record as saying that they expect their capacity to be in hundreds with a few thousand over the 5-year period. Given that 28,000 people crossed the Channel last year, does she really think that this scheme is going to have the deterrent effect she claims for it?
So his question is yes, and the scheme is uncapped, and that is exactly what we've negotiated with the Rwandan government.
David Davis.
The Home Secretary is quite properly focused on saving lives. So can I ask her a practical question? The World Bank has said that Rwanda is one of the highest incidences of malaria in the world. Our own government website warns travellers about hepatitis A and B, tetanus, typhoid, cholera and tuberculosis, not to mention rabies and dengue fever, which can't be vaccinated against. So what is the government going to do, both from an ethical and moral point of view, and to protect the British taxpayer against compensation claims, to protect the asylum seekers who go to Rwanda?
Well, my right honourable friend has made some important points, because the work that we've undertaken and the partnership with the Rwandan government is based on support directly to them, but also expertise, technical expertise in terms of resettlement, education, training, but also, as I reflected upon in my oral statement, Mr. Speaker, providing care in terms of the health and resettlement needs of those individuals.
Paula Barker.
Mr. Speaker, the proposal to treat refugees differently, purely based on how they arrived in the UK, undermines a key principle of refugee protection. Such an approach weakens the very foundation of the 1951 Refugee Convention and contradicts the steps the UK agreed to when signing up to the Global Compact on Refugees. So, what legal assurances did the government seek about protection of people in Rwanda and